Um, so, uh, as an introduction, my name is John Buckley. I'm the Design Strategy Director here at the Public Policy Lab. And in my role, I co-develop our approach to how we do projects. So, and that will be relevant as we talk because we're talking about how we're doing this work, how we do our work, and how uh, uh, change management is becoming ever more increasingly a part of that work. Um, I also support our various teams through that approach that I co-develop um, here. And so that's just making sure that they're following the kind of the process that we've outlined, and also that they're achieving the project goals that they have set for that specific project. At any one time, we have about 7 to 10 projects live now at Public Policy Lab. And then I additionally provide some in-depth oversight on some specific projects. Um, and the case study that we have today is one of those projects. I'm joined on this call with my colleagues Isabel and Pallavi, who will be on the chat. So if you have any questions throughout this process, throughout this talk, just leave a chat inside, leave your comment or question inside of the chat, and we'll get to them in a Q&A portion a little bit later on. And they might give some direct responses in the meantime as well. Now, I just mentioned that I'm the Design Strategy Director of the Public Policy Lab, but who is the Public Policy Lab? And we are, for those of you who have not been initiated yet, the first nonprofit design policy design lab for government in America, as far as we're aware. And we partner with government agencies and philanthropies and foundations and NGOs to design policies and services that improve the lived experiences of low-income and marginalized populations. So as a nonprofit, that's our client, the low-income and marginalized communities whom we serve with our government agency partners. I mentioned that we do service design and we do policy design. Those are the two big, primary types of work we do. In my mind, I break these down with our service design projects being where a government agency partner has a very clear process or program or service where they want it to be reevaluated, redesigned, reimagined, or just created from scratch, but they know exactly where we're going and what we're doing. There's usually like a service blueprint or a journey map that is going to be foundational for, or a process map that's foundational for that work. The other type of projects we often get a public policy lab uh, are more like wicked problems where there's not a defined uh, service or program or process that conjures up the problem. Actually, we probably need to bring together multiple divisions or even multiple different agencies to find intervention points where we have different services and different programs or different processes that can address the problem that we're trying to solve. And as we're doing those two types of primary types of projects, we often also are in the world of product design. We do human-centered research, change management, which is the focus of today, and community engagement. And we do all of that kind of work across the different breadths of practices. So that's education, health, housing, justice and violence, veterans, families, across the breadth. And in our work, we have four values essentially that all our work is human-centered. And we'll talk today about human-centered change management. But that just means that as we're doing this work in a human-centered way, that it is, we always start with conducting research with folks who have lived experiences, either as frontline staff or more to the point, end service users. We're co-creative, which means that we don't kind of take that information and then go into our back rooms to figure out the solutions for communities, but actually we go into the communities again and try and hand over the pen as much as possible to co-develop, co-create these solutions, these interventions with folks from the communities and with frontline staff as much as possible. And our solutions are as much as possible iterative and material and iterative, which means that we avoid ever finishing a project with a strategy deck. We want to make sure that as designers are creating materials that will ensure that strategies we create live on in the real world in a tangible way. And those materials are iterative, which means that throughout the design process that we're refining them and to get them to a place where they're ready for scale. And then in our work is time-based and holistic, which means that we don't look at single interactions in isolation, but rather we think of them, as part of a wider journey or as part of a wider context. And we need to be aware of that wider context that was the service user or the process map that we'd be thinking about. And so just making sure that we're carrying all of these four approaches or values in our work. Okay, so that's the spiel on who we are, who I am, and who we are. But today we're talking about change management, and I want to start off by talking about the distinction between change and change management, particularly as it relates to how a design firm would think about these two. So starting off with change, which is, we can define as the act of making something different. So this is where you have a design, possibly a design process. You're trying to solve something through an innovation process. It's commonly outsourced to design agencies or even just design teams inside of large organizations, but not so much typically done by operational staff in an innovative process. And the issue with that is that outputs are not always implemented as intended by the design team. So once the design team steps away, that kind of energy shifts a little bit. On the right-hand side, we have what is arguably the most famous process model for kind of human-centered design or design thinking, which is the double diamond, where we start off with a challenge, an organizational challenge in many cases. We go through exploration to really figure out, reframe that problem, to have a clear understanding of what the problem is. And we go through another process to end up with an intervention, with a solution, with a concept. And the reason it's diamond shape is that you start off and you start exploring in quite a exploratory way before kind of refining that. So there's converging and diverging aspects of the thinking that happen along that journey. And this process has been mapped in many different ways by many different organizations, but almost always to the same point, which is that you involve people in the process, you understand the problem from multiple perspectives, and then you ideate and create solutions, and you get to a point where you have a thing, you have a change, whether that's a product, whether it's a digital tool, whether that's a service model, whether it's an interaction model, whatever it might be, but there's the shiny object in the middle. I think the other part of that is that we have change management, which is the process of a considered implementation of a change. So this suggests that you already have figured out the shiny thing, the change. You've already figured that out. And now what you're trying to do is you're trying to implement that thing in a way that is consistent, in a way that is folks get bought in, and it really lands, it really happens. And for this, there's many different methodologies. There's not the same kind of landing direction as there has been in the kind of the change or the design innovation process. You'll find many different types of change management processes or methodologies. More often than not, this is overseen by in-house teams, often operational teams. However, the common issues with change management is that it's often a top-down approach. And so, a lot of times it's difficult to implement if the frontline staff haven't been engaged in that process in a meaningful way. Probably the most considerate version of a change manager, the mainstream change management methodologies is this one on screen here on the right, the ADKAR, which is really thinking about how to engage the staff who are going to be responsible for driving the change. So you start off with ensuring that they're aware of the change, you build their desire for making a change in their workflow, you provide them with the knowledge so that they can actually make that change, and the ability to do so, so you kind of remove any barriers, and then you provide that reinforcement so that they continue to drive that change forward. Some other models are on screen here. Again, these ones are a little bit more at the organizational level, particularly the Kotter's 8-step model, which is probably the most famous. It's about creating urgency to show the need for change. building a coalition of powerful partners who are well positioned across the organization to drive that change, forming a vision so that everyone can kind of see what this change looks like, enlisting champions who will actually drive this, early adopters who will drive the change across the organization, um, enable those actions and remove the barriers from them to go and do it. Generate some quick wins so you have some evidence of success. Sustain the acceleration of that change so that once you have those quick wins and you get more institutional buy-in, that you kind of pick up the pace as opposed to let it sit at that point. And then institute the change so that it becomes part and baked into the systems and the tools and everything else so that the change doesn't kind of evaporate over time. Um, and I think one thing is that, sticking with the status, the reason for all this change is because we stick with the status quo and we know that that's actually a bad thing, right? Um, but I think what is sometimes missed is that actually, a poorly planned change is worse than no change at all. So if you are in a situation where you have the shiny thing, but you don't have the ability to do a kind of a considered change management process, I think you might have to actually avoid making that change. So avoid change unless it's necessary and you have the resources to implement it effectively. So poorly rolled out and regular change is quite disruptive to frontline staff. Um, and what it does is it builds a culture of mistrust in new initiatives for those staff. And so what happens is that over time, staff become quite demoralized by the changes that are constantly brought to them. It can affect the service implementation. It can affect kind of how the job is. And so you want to make sure that we don't kind of create change for change's sake. And so that means let's kind of think about that and actually what then is the first key step? And it's probably determining whether you need a change management process or if you need a change project or if you don't need any of them. So if you don't have a clear, good new process or tool or policy or service, you're probably best off having implementing a change project. If, on the other hand, you have something that works or and you want to scale that thing to the rest of the organization, or you know it could work, but it's inconsistently applied across your service team, then maybe what you actually need is a change management project or process that just ensures that change is being more effectively implemented. And if you don't have a clear need for change or you lack the resources to implement a change, then you probably actually don't need either. And that's okay. So I want to talk a little bit about PPL's journey to change management. So I mentioned before how we are primarily a design organization. And so when we started doing projects 14 years ago, uh, and just like other design houses, you kind of focus on the actual change. What's the innovation, the product or service that we're creating here? And very quickly, we realized, and this comes true doing human-centered design, that the change uh, itself, when you conduct research and you understand the issues on the ground for frontline staff and for the end users, you start very quickly thinking about the change primarily, but also making sure that that change is designed, that innovation is created in a way that helps with the ease of implementation. Where we've gotten to in recent years is that we start off the projects with the change, with the innovation, with the thing that we're all kind of gathering together for in our design projects. But over the kind of the process of our projects, we shift from focusing on that change to focusing on how that change gets implemented and supporting with the implementation. So this is where we've been at Public Policy Lab for the past few years. And in recent times now we're shifting again to where we're centering change management from the very start of these projects. And so we're actually thinking about the change management before we've even fully figured out what the change is. And so we're bringing change management and having that consideration with us from the very beginning of the design process. And that's kind of where we're moving to now, and we're figuring out how that looks. I mentioned earlier that we have our own our project model, our approach and this is it. This is PPL's release model. It's a 10-step kind of journey model, I guess, 10-step approach to how we conduct our work. And it always starts off with, really understanding the problem in this kind of planning phase, and then conducting research to get to concepts. And so if you just pause there for a moment, you'll probably notice that that actually looks quite like the double diamond we referred to earlier. And essentially it is. This is where we get to having some concepts for solutions or interventions for problems. The next phase is where we kind of layer into that now. So now we're thinking more about, okay, so we've got these concepts. Let's actually involve frontline staff and involve service users in really developing those fully, so that they work in their contexts. Let's pilot these in a small scaled way so that we can ensure operational teams are prepared for this isolated pilot. And we will kind of go through a small scale approvals process so that the overall agency and the infrastructure is all kind of, the wheels are turning, so that even if it's just for the small scale pilot, everything is kind of is in flow, is in process for what it will look like when we're doing a full kind of change implementation. Once we have that, we'll run that small pilot, which of course for our design team gathers feedback on whether or not those innovations, that change thing is effective, is working. But also, and this is where we're shifting more as this project moves along, also now we're looking at how does this improve our knowledge of what the implementation needs will be. We'll redesign those products and services based on the scale to launch the pilot, but we'll also be using those findings to inform a scaling plan. And that scaling plan may mean that the products need to look slightly different than they do for the small launch, but more importantly, may mean that we have a rollout strategy, a training strategy, an onboarding strategy that looks a little different than it did in the small scaled launch, in the pilot. And then the last phase of our work is the integrate and scale and share, where we are really broadcasting these changes. We've now gone through a process of design, of iteration, and of kind of figuring out how we're going to scale. And at this point now, we're broadcasting these changes to the wider staff beyond the pilot folks and beyond people who helped in our discovery research work up front. And we're integrating these new products and services, processes into the digital systems, the trainings and the workflows of staff. We're onboarding and we're training the relevant staff. And importantly, we're also sunsetting, we're offloading the old systems or tools or processes so that those things no longer exist in the digital tools or in kind of shared folders, so that to encourage adoption of the new products. So that's kind of across a project how our design process bakes in and supports the implementation and the change management of the work. I want to talk a little bit about, just kind of make this real inside of a case study. And so we recently completed this project, Prevention Pathways. And I know some folks from both agencies of this are on here now today, but ACS is the New York City is Administration for Children's Services. And here in the city, they're responsible for the Child Protective Services. And they also operate, a different division also operates our prevention programs, which helps families who are at risk of entering those Child Protective Services to avoid them and to receive support where they're, where they wouldn't benefit necessarily from being in the Child Protective Services. Now, what's interesting about these support services, these prevention programs, is that unlike other social services in New York City, these programs are not fully subscribed. And so ACS sought to work with PPL to understand why more families are not entering programs, and to essentially increase referrals from into their prevention programs from other agencies and other public schools or hospitals where people are identifying a need and may be likely to share or kind of report families to the central registrar uh, for neglect. But actually, instead of encouraging those staff to not do that, if it makes sense, and to instead refer them into support services. So the goal of this program is for the ACS prevention programs, so they're not fully at scale now, to have, or not fully, sorry, not fully at capacity, to be at capacity. And that really actually involves not so much the ACS prevention programs themselves to be modified, although we have some of that, but really thinking about, well, what are the needs for staff in these other agencies, in these other settings, whether it's a hospital, schools, whatever else, to refer into these programs, and what are the barriers to doing so? So this becomes a multi-agency, cross-agency change management project, which just adds a little layer of complication to it as well. It makes it a little bit more interesting. So we have 6 key actions that we did. And the first key action when working with ACS was to identify a partner who shared the vision and objectives of the ACS prevention team. And so the ACS prevention division, they work with many different city agencies, community-based organizations, schools, to support and help those social workers refer folks into their programs. But in particular, the New York City Health+Hospitals, who's the public hospital system here in the city, they've recently been investing a lot in their Office of Child Abuse Prevention and Treatment, and have, really committed to referring to prevention services where possible. And so the working relationship between these two agencies was already quite strong, and it felt like it was a really good partner to engage for the first round of this work. And so, by having a partner who has a shared vision and shared objectives, it means that you have quite a cohesive team. There's not going to be down the line some different goals that might create a fork in the road for the shared change. The second key action was to ensure inclusive, transparent communications throughout the whole project. So we had 2 different agencies, and as consultants, design consultants to both, we had obviously relationships with both sets of partners, but we wanted to ensure that health and hospital leaders were included in every single one of our project meetings, and that any conversation of consequence, whether with either partner, was always held in an open space, whether it's an email thread that includes partners of both sides, or meetings where representatives from both agencies were included. The third one is that we co-designed and tested change with staff and users of both agencies. So the co-designing and testing of the change with staff and users is, as I mentioned earlier, part of PPL standard practice. It is how we run through our projects. However, and so in this instance, we saw even just the pilot, from the research to the pilot, we had a whole bunch of insights from users, and one of those most interesting ones is just having the lens of if we're talking about prevention programs, it's very much an organizational term for prevention from going into the child protection service system. But from a family's perspective, if I'm showing up to a hospital or getting support at a school, I'm not really thinking about prevention from something worse. I'm actually thinking about support. I'm receiving support for stronger families. And so just shifting that language from kind of thinking about prevention to we kind of use the terminology of family support programs for family-facing materials. But I think what's interesting here is that we kind of did that with both agencies at the same time. So that ensured that we had a unified process, and so that both agencies were on a shared journey, and we also had a regionalized pilot. And that pilot meant that we had different hospitals selected and satellite prevention providers around them, so that the referrals, we could see in real time how the referrals were kind of connecting from those providers, the prevention program providers, to from the hospitals, and how those relationships were developing. And through that pilot, we identified the needs we identified additional needs that were missed from beforehand, whether that's simplified materials or misalignment between partners that, in a contained pilot is totally safe and secure, but it would have possibly been more problematic to kind of have materials that are not perfect or misalignment at scale, launched at scale. The next key action was to, we ensure that we're integrating staff at multiple levels. So from small things like we held a pilot launch for this project at the health and hospital location, to highlight that interoperable connection between rather than an ACS location. And at that event, we had networking for the social workers from the hospital with the ACS prevention providers staff. So again, kind of strengthen those bonds and those relationships so that there would be more referrals between them. And when we redesigned the referral pathway and the training process, we again in both of those are designed to encourage social worker and staff interactions between the two sides of the agencies. And even just like as we're setting up the implementation, getting the implementation ready for both the pilot and subsequently the system-wide launch, ensuring that required support from both agencies and collaboration from both agencies. And so we've, as much as possible, connected the two. So that's at the frontline staff level, at the operational level, within the working group, and even at a more senior level in some of these kind of milestone meetings. And by integrating the staff at multiple levels, it just makes the collaboration that little bit stickier. Number 5 and 5 of 6, we leaned into the grunt work. So when we think about design projects and innovation projects, it's often quite sexy. It's, sticky notes and sprints and creating innovative ideas. But that is definitely part of the work. However, if you look at the number of hours that go into making sure that smart innovation becomes sticky and stays and becomes implemented, there's so much work that happens around that. And so the vast majority of effort is not actually in that initial design ideation process where you get to really interesting products, but is actually, working with product owners to have integrations into existing tech stacks, or in, working, thousands of hours for this prevention pathways project went into, training decks and copy for emails or copy for templates, or just coordinating between different people and having policy clarifications and going through legal reviews. And so there's all of this work is helpful, particularly for government agencies that are short-staffed, to be able to know that they're not picking up something from a couple of decks and then trying to make it real, but actually they're also receiving the support to kind of just greenlight it. And so by leaning into the grunt work as designers, the design team, you're really setting up for implementation success. And the final key action is that we leveraged proven change management methods. So I really walked us through PPL's design process, and also inside of that, the change management steps that we have as part of that process. But when we get to especially for this project, when we got to the point of really handing over control over to the agencies, we kind of fell back to using Cotter's 8 steps. That's the framework that we use for the health and hospital change management plan. And similarly, as we're developing the ACS plan for their system-wide rollout, their action plan, we had the ADKAR method in mind. So that by leveraging kind of proven change management methods, we're able to build credibility in the process, and so that enhances the chance of success for those who are tasked with implementing that in the kind of the long form manner. Okay, I'm going to share 2 PPL tools with you, and then we can open it for questions and answers. So if you do have any questions on anything I've shared so far, please do feel free to start dropping them into the chat, and we can talk about that. So 2 tools, one of which is something famous here to all Public Policy Lab staff and former alumni, I'm sure, is the Policy Lab layer cake. And this is a methodology or a product, an internal product that we use to think about our designs and our partners and our needs from multiple layers. So it's not that we want to create products that help frontline staff and members of the public interact, or just products that support the frontline staff in being able to have for that interaction, training materials, whatever it might be. we also want to be making sure that we're thinking about what are the needs of service managers, what products can be created here, what about, what are the systems and the rules and the protocols that program leadership are thinking about, and eventually what are the policies that maybe public officials even need to adopt or reconsider for more of a systems change. If we kind of stay at the service delivery level, the change is very surface level, and the further down this layers that we can go, the more impact we can have in a system. And essentially, that's as a nonprofit looking to drive change, we want to always go down that layer cake as low as possible. And on the right hand side is a zine that we did a limited production run on last year. We can share this afterwards. There's a digital version of this that we can share. I think we might be doing another print run later this year, but it's something just kind of look at and consider that in as much as you're looking at driving change, you also need to be doing that and thinking about it at different levels and scales. And that's true for change management as well. So as we're thinking about this project from a change management lens, also thinking about, well, what do we need from each kind of category here at each level. And then the other tool I want to share with you that was useful in this project and has come from past PPL work is the healthcare communications flowchart. So this initially was developed from a project where I think it was 2022 or 2023, right after the pandemic, but trying to understand how healthcare information, how in that case it was infection control information, was moving from national and state guidances through into the kind of healthcare systems, such as health and hospitals, from there down into healthcare individual hospitals or clinics, and from there down into individual wards or units, and then how that information got kind of conveyed to frontline staff to enact. And so we did this work across the country with looking at how information was flowing at large hospital systems, small hospital systems, community hospitals, nursing homes, independent outpatient clinics, connected outpatient clinics, to see if there's any commonalities. And I think this tool helps us think about who are the different roles, what are the different roles involved in this process, what are the different materials that they're thinking about, and as this kind of information is moving from that guidance to a policy to a workflow or kind of a protocol, and then maybe into training materials if needed. And so that's also how we're thinking about how do we actually help communicate these changes inside of the hospital systems for this project. So we can share that as well if that's of interest to folks. And that's it. That's me. We're going to open up to questions and answers. Isabel, do we have? I haven't been looking at the chat, so.
Yeah, we've got a few. So Daniela, one question we can start with is how we balanced priorities and desired outcomes with budgeting constraints.
How we prioritize, can you say that one more time, sorry?
How we balanced priorities and desired outcomes with budgeting constraints.
Okay, do you want to say more about that? And who was it from?
It's from Daniela Velez.
Daniela, are you able to unmute?
Yeah, sure. Hi everyone. So I am a last year master's student in Chicago studying design and policy administration. And right now I am curious to see, I know design can make a difference, right? Like we all know that. But then when you are talking about budgeting and saying we have these constraints and this is how much this project will cost. Like, I don't want to talk in terms of cost efficiency, but how do you sell the idea of the project? I know you talked about partnering up, and I was like saying, okay, we have to partner with people that have similar values within organizations and that sort of thing. But then, like, yeah, you also have to put budget. Like these projects take longer, they are better, but because they might take longer in the shorter term, they will also cost more, even though in the long term, those costs will be, like
Yeah.
buffered in a certain way.
Yeah. So I can speak broadly to this, that what we've tried to do by incorporating change management into our kind of existing design process is to reduce the cost of change management, because it's kind of time that we would already be spending on making the product the change, and testing the change, and testing the product. So we're not, we're using the the moments again for two different rationales or whatever. I think in we've also identified, like for this particular project, the ACS one with Health and Hospitals, Prevention Pathways, we had previously worked with ACS on a different project, did this kind of division, and that project needed another phase of work for implementation support. And so these partners were particularly supportive of the fact that we would need more time and energy and effort for that change. But I think what we've done more broadly is by bringing it into our release model, uh, we're kind of ensuring that the thing is stickier than it would have been otherwise. And this is coming from lessons of many times doing projects like this, even where we've got testing and we're iterating them and we're preparing them to hand over. And we've done so without actually meaningfully engaging their systems, so that they're implemented or implementable, or easy to implement, I should say. They're implementable. We know they're implementable, but they may be not easy to implement. And so I think just taking the time and giving yourself the energy, and we have that luxury as a nonprofit as well, I guess, is the other thing. Like we try and price our projects to be competitive and everything else, but we are, at the end of the day, not driven by any profit motivation. So if there is a cost overrun or additional staff time that was unexpected, it's something that we sometimes eat up as the importance is more into the mission to drive change. And so we kind of expect that we're going to have to do a little bit more to drive change. Thank you for the question, though. Isabel, do you have another?
Yeah, so there's two kind of related to that thread. The first is our lived experience consultants. So for this project, I think that means the parents and caregivers paid for their participation, and if so, how do we manage that with our partners? And so yeah, everyone that PPL interviews who aren't already being paid for their time we compensate. So the frontline staff or agency operational staff that we might interview are being paid for their time on the clock. So we don't provide them compensation because the partners are. But any parents or caregivers or members of the public that we interview or do co-design sessions with, we always compensate them for their time at the same rate of an entry-level PPL staff member. That's just sort of our policy, and we had no difficulties getting our partners on board with that. They felt, really strongly that the lived experience of parents was really valuable. So we are lucky in that sense. John, did you have any other thoughts on that?
No, that sounds good. I think Judy just asked, how do we cost that in? And we do, we kind of build in some bulk into our project costings, knowing that we're going to have some incentives, and also that we might have some material printing that we do that helps just trying to drive things forward. We wouldn't obviously print things for a whole system-wide rollout, but we would maybe for a pilot. And so we try and save some budget aside for costs like that.
Another question is how we kind of sell our human-centered design approach to partners compared to a more traditional design process, if it might take a lot more time.
Yeah, well, we're fortunate that the partners that we have typically come, to us at this point after doing this for 14 years, as we have relationships across federal, different states, and different agencies here in New York City. We do a lot of work in New York City. And so it is very much baked into our narrative that we do human-centered work and that we start off every project with folks with lived experience. Um, and so that doesn't typically end up being a shock to folks. I do think that um, the the there can be challenges in just like how much additional work and time that takes can be surprising to government partners. But for those who are already baked in, and we can kind of explain why this is taking time, and demonstrate how much work is involved in that. It tends for those who can identify budget, um, it tends to not be something that just closes down that conversation all too much.
This
And then
next
I should
question.
also say that we have a particular we're trying to do this more and more where we take the things that we do with projects, particularly where we have someone like a New York City agency that will have access to, if not a large budget, access to connections such as philanthropies, or the ability to go to foundations of philanthropies, and find money for work because it's impacting the lives of so many people. We try and take those insights or these kind of deliverables even sometimes and share it with smaller cities. So or share it with the federal government who can then share it with other cities who would not be able to afford such work. So that's another way of trying to push this mission along.
Another question that got a handful of thumbs up, which I assume mean other people have the same question, is a huge issue in child welfare is racial disparities on who is referred/reported to services and why. Did that come up at all? If so, how did you address it? And yeah, this is essentially, I think, one of the largest like reasons behind this project and part of why ACS Division of Prevention and Health and Hospitals have been doing a lot of work to make these services really robust on ACS's end and on Health and Hospitals end, really examining their mandated reporting practices and moving towards a kind of, supporting practice. John, I know you were more involved in like the scoping of this project. Do you want to speak to that?
Yeah, no, I think you nailed it. I think that was it's not only did it come up, it was the rationale for the project. So yeah, and it kind of came up time and time again. But yeah.
Um, Nora's asking, how do we follow up with and iterate on these projects potentially years down the line? Which is very relevant because we are about to, end this project next week. So PPL schedules, I believe, like 3, 6 month, and like 1 year out check-ins with partners to see how implementation is going, and how the materials are being used, if they're being used, if there's any like policy updates that are affecting things. Um, and like John said, a lot of times partners circle back to us down the line and create new projects that might be related or kind of spin off. So we've done many projects with ACS. And we, even though our involvement is technically, kind of wrapped up, we still try to support as much as we can.
Yeah. This is one of the issues with having a funding model that is based around projects is that it means that we don't have the ability for continuing ongoing support that we would like to. And that's also another reason why this change management and the implementation stuff has become more and more important to us because we've seen over time when we've created a thing and then walked away and folks are left looking at the thing and being like, what the hell does this mean? Doesn't make any sense out of a context of a design studio. And so I think that's also why we will try and make it as sticky as possible now.
Angie's asking how many staff from PPL were involved in this project because there's a lot of different moving parts. I'm wondering if there are people who specialize in different steps or areas in working together. So at PPL, we kind of move staff on and off projects during different phases of work. So during research, there were 4 of us. There were 2 of us who had more of a research background, Pallavi, who had more of a design background, and then our project lead, Sheila, who unfortunately could not be here today. And that was kind of the most we had. And then John serving as sort of the senior supervisor. During like the pilot launch, there was only 2 of us with the support from the senior staff. And we always try to have a balance of having a designer on hand when we're in like co-design or redesign when we need that expertise versus having a heavier research background during the research phases.
Yeah, we're flying through these questions. Let's keep going. Can we get to them all?
Let's see. Someone asked about Judy says that in the past they have found Cotter's 8 steps difficult to integrate with the human-centered design process. It's linear. It assumes perfect conditions. Very old. Can we talk more about how we used it meaningfully? And curious, how useful it really was.
Yeah, I think the issue with change management practices and Cotter being a great example of that is it really it's built around this idea of the managers know best, and then they will inform the staff of what needs to happen. Um, the so how we used it in this case was at the very, very tail end of the process. And almost as an organizational, or as an organizing principle for the different steps that we were outlining for our partners who for them to, they may follow. And by doing that, we've already kind of gotten to the process where the change has actually already been validated by the frontline staff because it was it was co-created by them. And so even though it is the top-down approach, we are ensuring that the kind of the champions who are going to drive that forward are folks who might also have been part of the pilot, for example, and that the change that we're kind of pushing forward in this way is actually really it's top down but bottom up as well. It just happens that the kind of the way of communicating to everybody else is probably going to have to be as much as possible. We're going to engage those champions to bring it across their different divisions and the different in that case like hospitals or clinics, but it will need organizational kind of leadership to do the pollinating. And our partners in the health and hospitals particularly are I think very open to iteration on that. And so as feedback comes back from frontline staff who have not been part of this process, I can imagine that they will also be adopting and for the continued expansion of that change.
So there was a question earlier about if evaluating the programs themselves was part of our scope, to which I replied no, but obviously we, if we heard any feedback, we provided that to ACS, in part of our findings. And so someone asked a follow-up question about, if outside of our scope, how can we assess if implementation ultimately improved family outcomes? Which is a good question. And it's kind of unfortunately, a much longer term process than like our direct involvement allows. ACS and health and hospitals will ultimately have to keep working together over time to get that feedback. These programs are at the shortest 3 months up to a year long. So getting that kind of feedback through program wasn't really part of even our pilot. What we talked to families about during the pilot was, about the referral process itself. So if they had, an improved understanding of what kind of to expect from the service, if they felt like, they knew what they were getting into, it was clear to them how they sort of understood what they needed and what their agency was in the process. So those were the kind of outcomes we were able to talk to folks about.
And the prevention programs themselves are evidence-based programs. So even like I said, a design approach would probably not be capturing the level of success that has already been measured for those programs. Those are evidence-based programs. I think what we would be looking at more is how frequently was the referral process a success?
Megan has a question about key action 5, the grunt work. How did we manage that with clients and partners? Who leads? How do we ensure materials are accessible for intended users and audiences?
Yeah, I think this project is an example of where we've kind of gone deeper in that than usual, and I think it's a messy process. It really is at times unclear who should be doing certain tasks, especially when we're kind of getting into the weeds of writing emails in the kind of tone of somebody or whatever else. But I think what we did there is we always ensured that the relevant folks who were responsible inside of these agencies were always kept abreast of any things that we were creating or any outreaches we were having inside of their systems, so that if there was ever an overstep, we were able to hear pretty quickly from the agency partners that was, you know, that may be an overstep or whatever else. But typically, our partners, and this is maybe a kind of a government-wide issue, are just thankful for having hands to do things. I think a lot of the experience for a lot of folks, program leadership, is that they have the ability to get kind of nice looking decks, presentations that tell them what they can do better, and not enough actual kind of the work done for them to kind of press send on or whatever. So typically our partners have just been looking for more of that and less of a shiny thing. And so it hasn't actually been in any case a problem. But I think it does create like some challenges in just knowing like whose responsibility this is, and making sure, of course, that we're designing this so in a way that we're stepping out more and more and more. We don't ever want to put ourselves back in the middle of what is the implementation, because then as soon as we step out, we will end up leaving a gap. And so it is a tricky thing to both be a resource that is helpful, get in the weeds of something, and also not be so centered to it that it takes from the implementation effort.
Mm-hmm. And just to that point, I think having like one of the other key points, having staff at different levels of these agencies kind of in our working group and have build relationships with them. You know, we did research and conducted interviews with staff at different levels as well. So we had relationships with these folks that later on during implementation, we needed to come to and say, okay, you're in charge of like the Airtable system, and now we need to work with you directly on, you know, making this thing work in ACS and digital systems. So it's kind of a long process that starts to pay off towards the end. We've got about 2 minutes left. Is there a wrap up?
One more question, and then I'll wrap up.
Okay. Last question. Curious to learn about what the co-creation process is like, especially for service design projects. Does that mean involving the end users, and how is that work managed? So yeah, like I think I mentioned earlier in the chat, we did a few month long period of co-design, and that was with frontline staff at health and hospitals, so social workers, some pediatricians. We also worked with prevention providers, so program directors or social work staff there, and then parents who had experience of being referred to these programs or going through them. So some of those were more generative, like we would walk through a journey map with parents and say, like, what kinds of materials do you want at this stage? Like when you arrive at the hospital, who do you want to talk to about these programs? What do you want to see? What do you want somebody to take home with you? And then we would go back to those same people with the things we had designed that they had asked for and ask them to, you know, play around with it, write all over it, and give us feedback on how to make it better. So we tried to involve, you know, the same people multiple times to get feedback on multiple iterations of products.
Yeah, and it looks different in, I guess, all our different projects in terms of the degree to which we kind of have workshops and that. I'm conscious that we're basically at time, and I know that I need to share one or two last slides for folks who are interested in working with PPL. The good news is if you're in a New York City agency, if you're a New York City agency staff, there is some funding mechanism, a budget set aside for PPL to support you. So that can look like a small or medium-sized collaborative design project, kind of like what we're talking about today, smaller scale, capacity building workshops, and also office hours. And so if you're a staff in New York City agency, you know, email info@Public Policy Lab with any suggestion you would have for a collaboration you'd like to do together. If you are not inside New York City agency, or you have something, a bigger kind of change management type project that would not be covered by that fund, feel free to reach out to me, Buckley at publicpolicylab.org. Additionally, if you email info@publicpolicylab.org and just and kind of address it to me, it'll end up in my inbox somehow. So those are two ways to if you do want to work together. But otherwise, thank you so much for coming along, for engaging in these conversations, for all the variety of questions, and for yeah, sticking along. We have most people stay through the whole end, so thank you so much for that. All right, have a great rest of your evening.